Thanks. Every day we take about 20,000 breaths, but how often do you stop and think about the health of your lungs? November is Lung Cancer Awareness Month. It's a time to shine a light on the importance of prevention, early detection, and really taking care of the organs that keep us breathing. Joining us now is Dr. Mark Godfrey. He is the Director of Bronchoscopy and Interventional Pulmonology for Hartford HealthCare. Dr. Godfrey, thanks for being here. So let's start with the basics. Who really is most at risk for developing lung cancer? And are there some risk factors that you might not expect?
Good afternoon. I think most people are aware that tobacco smoking is far and away the biggest risk factor for cancer of the lungs. So smokers are 10 to 30 times more likely to develop it than people that have never smoked. I think some of the things that we forget to think about, that a lot of people in Connecticut face is radon in the home. And so, being sure to get radon testing, when you have a real estate transaction, or even every few years, or if you do construction, that's important. And we're still trying to figure out what the risk is going to be from e-cigarettes and vaping and things like that, but it's still kind of undefined at this point.
All right. So tell us about the Hartford HealthCare Lung Cancer Screening Program.
So the program here works basically with your primary care physician or whomever may have ordered your screening scan. And if there are abnormalities on the scan that need attention, it comes to our program. We have a team of experts, radiologists, lung doctors, surgeons, and everybody sort of works together to figure out what's the most appropriate next steps depending on what's going on your scan.
So who's eligible for this type of screening? And if we're not being asked to get one, should we be advocating, saying, I want a lung screen?
So the age range that we look for patients that are eligible is age 50 to 80. So, if you're eligible for your colonoscopy, that's kind of the age when we start thinking about this too. And we're screening smokers. So people who have smoked for what we call 20 pack years. So that's smoking a pack a day for 20 years or like half a pack a day for 40 years. And then people who are current smokers or who quit within the last 15 years. And I think more and more patients are being offered this life-saving screening test through their PCP, through their lung doctor. But it's also patients can advocate for their own health and ask to have this done.
Okay. And quickly, what makes your program at Hartford HealthCare so unique?
Well, we have done a couple of pretty unique things in the state. Patients that have a suspicious spot on their lungs, we can do a biopsy procedure and a surgery sort of at the same time. So patients will go to sleep with a suspicious nodule and wake up having been, cured of their lung cancer. And so those kinds of technological advancements and providing kind of state-of-the-art care, we're obviously trying to do that. But I think the thing that sets us apart is taking the time to talk with patients, explain what's going on their scan, take their sort of preferences, their anxieties into account, and really come up with a plan that's right for each person and not just kind of following a cookbook.
Right. Good advice. Thank you. And hopefully we're raising some awareness so we can ask the doctor. Thank you so much. And for
You're
you
welcome.
At home,
Take care.
Yeah, for you at home, please look at hartfordhealthcare.org/cancer to get some more information.